I'm Fred Wintermantel. I'm a physical therapist assistant here at OSC, and I'm going to talk about two different exercises to help with core stability and balance after hip surgery when you get released to do physical therapy. The first we'll talk about is a trans-abdominal hold. It's basically the muscles from your rib cage down to the lower part of your pelvis. So my friend here is going to help us. I want her to think about using the bathroom and then tightening up and holding it so she doesn't use the bathroom. She can feel on the inside of her pelvis bone. It's not a super big contraction, it's a small contraction, but just tightening up of the muscles coming down into the pelvis. Feel it? Mm-hmm. Good. So she's just going to hold it for about 3 seconds, relax, and she'll do about 10. Now you notice that her chest does move a little bit, but as she gets stronger, she won't do this. She'll be able to do it like this, where there's no movement of her upper chest. This helps stabilize the pelvis with pretty much any activities, but it also helps with, notice more with females after childbirth, strengthening the pelvic floor so there's no leakage. Coughing, sneezing, laughing. People tend to think that, oh, I have a little bit of leakage, that's normal. It's not. This helps strengthen the pelvic floor to stop that. So after a hip replacement, generally you'll have a walker where you'll have this forward-leaning posture. This helps stabilize your pelvis, making stability through your core a little better to get you upright and taking pressure out of your back. Sometimes after surgery, you're here and you have pressure through your lower back. This will actually help kind of counterbalance that. So the next one is called four-way hip. So after surgery, when you're released to therapy, one of the exercises we'll start to get into is something with balance. Try to strengthen your hips with standing because it's functional. You have to walk, you have to move around, you don't want to use a cane. We're going to strengthen up your hips and balance so that you have a decreased risk of fall. So four-way hip, she's going to lift the left leg, kicking out forward, not moving her upper body, just the leg. She's also stabilizing with her hand on the side if she needs a little help with balance. She'll bring it back. That's forward. We'll come to me, out to the side, back in. No leaning of her upper body. She's working from the hip down. Then she's going to come across her body. Good. And then back. And then I want her to kick back towards the wall. Make sure she's nice and tall. Bring it back. And not leaning forward or backwards, trying to assist that hip. We want to strengthen the hip. She's not only strengthening the hip that she kicks with, but she's also strengthening the hip that she's got to stand on. Because when you're walking, you actually stand on one leg. The misconception is you're standing on two, but you have to lift that other leg to go forward. So we're going to strengthen both legs to simulate walking. Generally, we would want her to do, when she kicks, she'll kick out. She'll bring that leg back, relaxing the muscles, and she'll do 10. So she'll kick forward again, come back. She'll do it again, come back. She'll go all the way to about 10. Then we're going to move it into a different direction, so we'll go out to the side, back in. Making sure that she relaxes that leg. Don't keep it at tension. You want that foot to touch each time. Come back out, back in. And she'll do 10 this way. She'll do 10 across, and then back, foot down, across. And then she'll go into going backwards after she does 10 across. So flexion, abduction, adduction, extension. Hopefully these exercises help you. If you want further instruction, come by your OSC. We're more than welcome to help you.